All right, we are back for another week. I am your host, Dr. Michelle Paris, and this is the Rebel Talk podcast. And I am excited to be doing another 3-part series intertwined with some guests I'm going to be interviewing. I'm really looking forward to, the next couple of episodes we have ahead. These are exciting times. And so the next 3-part series, I thought I would cover an area of women's health that I don't think we've done a very good job of uncovering. That sounds terrible. It's not about not doing a good job. I just don't think it's been highlighted as much as other areas of women's health has been covered. So we've done a lot on infertility and fertility optimization. We've talked perimenopause and menopause, and I don't think we've done much in the ways of pregnancy, perinatal care, and postpartum care. Probably talked a bit about postpartum mood, but there are a few other things that we could talk about that I think are critically important. My passion for this aspect of women's health really came about when I myself became pregnant and had 2 babies of my own, and just really realized how we are best suited to help families during this really precious time and help women feel empowered during this process. And so my intention over the next couple of weeks is to teach you about things to think about, ways to navigate the healthcare system during this time, who to see when, and how to best work with a naturopathic doctor during this time. What are the right supplements? How should you be setting yourself up? Where do you get questions answered? Hopefully, this is a really informative series for you that helps you feel supported during your pregnancy journey, whether or not you are able to be local to us and have us provide care for you, which with the evolution of telemedicine, we are now able to provide care for anyone in Ontario. So I think that's really exciting. So that's really expanded our reach. So if you are a woman in Ontario and would like to work with a naturopathic doctor here at the Poppy Clinic, we are here to serve. But otherwise, if you are outside of the province of Ontario, it is just really great to have access to this information so that you can have more empowered conversations with your healthcare providers and know how to navigate through this journey. There are so many things you could be reading, so many books that cover this topic, and it can get a bit daunting and overwhelming. And this first episode is going to be on everything in the first trimester, which I thought I would have maybe just a few things to say, but I've actually tried to record this. This is the 3rd time, and I have quite a bit to say about it. So without further ado, allow me to get started. So when I became pregnant myself and through my postpartum phase, my practice really shifted. I shifted from a lot of pain management and sports medicine to moving into women's health and perinatal and postpartum care. I was so fascinated by this journey. I really thought it was so incredible what women's bodies could do. And I really felt like I wanted to show up in this way and provide care for women who were interested in having a more holistic, natural experience, or optimizing their health, or making sure that they felt properly supported through their journey. And that's really what started off my whole part of the brand, the whole part of my practice that is today called Dr. Mom ND. You can read more about it on my website at michelleparis.com. But I really got very fascinated in this aspect of health and really making sure that I was supporting the mother-infant dyad throughout many stages of pregnancy and postpartum. And I love this topic, so you're probably going to notice that. So when a woman becomes pregnant, it can be met with a bunch of emotions. I know for myself, I've had mixed emotions at times, always excited. I always wanted to be a mom from as early as I can remember. That was something that I knew I desired. But whether or not the timing was right, I remember thinking that it happened very quickly after my son was born, I 9 months postpartum was already pregnant with my daughter, and that felt really fast. And there were some emotions, and so I think it's really important to understand that you need to honor all aspects of that, and it is incredibly normal for you to have all different ranges of emotions. There can be a lot of mom guilt and shame with not having what you think is the appropriate reaction at any phase. I remember even feeling a bunch of shame postpartum because I found bonding really challenging. And we'll get to that when we get to the birthing portion. But if we don't give these things voice, if we don't create room for us to acknowledge our feelings and feel them, then they can really turn into little micro traumas that can end up influencing and impairing your ability to connect and bond later on. So it's really important to acknowledge that you might at one moment experience true joy and excitement, and then the next feel totally afraid and maybe anxious or worried or scared or not excited or sad. That would be entirely okay. It's okay. So once you've, acknowledged your feelings about this, the first thing I tell my patients that they need to do, or once they've told the people that they want to tell that they are pregnant, is to do two things. To make two phone calls. First is to their naturopathic doctor if they have one, because if you are on any type of supplements before to help you conceive, you need to make sure that you check in and make sure that they are still safe to take in pregnancy, because that really can shift. There are a lot of herbs that are not recommended in pregnancy, but they may have lowered the stress response to help a woman conceive, and therefore we would swap it or eliminate it altogether. So really going over that supplement list with your naturopathic doctor, I think, is critically important as soon as you know. The second or first, one of the two phone calls, the other phone call will be to a midwifery clinic or to all the midwifery clinics that are local to you. The reason I say this is I want women to be able to make informed choices, and I want them to have access to all the choices available to them. And in Ontario, I can say specifically, because I obviously know how the health care world works here, it can be really challenging getting assigned a midwife. They are in high demand here in Ontario. And so that makes it really challenging to be assigned a midwife if you call too late. And it's shocking how many women are already on the list when you call, when you're so early in your pregnancy, but it's a reality. So if you're not even sure if you want a midwife, all I want you to do is to get on those lists so that you have the choice to decide whether or not a midwife aligns with your health values and how you want to have care or be cared for in your pregnancy and postpartum phase. For me, a midwife was a no-brainer. I really liked the idea of the care that they provided. It seemed more holistic to me. So the care with a midwife has a number of perks for me. So let me explain them to you a little bit. Midwives are, I find, really do try their best to provide patient-centric or mom-centric care. They really are about providing as much as they can the experience a woman would like to have in her pregnancy and her labor and her postpartum care. They really do their best to inform and educate along the way. The care is more frequent and regular, so you know your midwife very well. You are assigned an entire team here in Ontario. So you are assigned a primary, a secondary, and a tertiary, and you will meet all of them before your labor. And so you know your entire team. And I loved everything about that. They are highly educated in a hospital setting. They provide the care that a woman chooses to have. So if you become a more complicated pregnancy, you will be transferred to an OB, and your midwife will still carry that care through. They will support you if you want a medicated birth. They will support you if you want a home birth or a water birth or in a birth center. So they're there to provide lots of options and ways of providing, of having, of experienced children, of experiencing childbirth. And I love that. I love options, and I love that they help you feel informed in that. So I always knew early on that I really wanted to try for a home birth, and I really wanted a midwife, and I wanted a natural birth. Now, if you're thinking that that's their approach every time, it's absolutely not. They are there, like I said, it's mom-centric. So they will provide the care that they can within their means and provide the resources for you to have the options that you want. So if you have this idea that midwives only support the moms who want all the natural, that's absolutely incorrect. And I don't think anyone really thinks that, but just in case, just to clarify things, they are just, their expertise is in birth and in uncomplicated, healthy births. And so for the most part, most births are. And so they are well suited for a lot of the population, which is why I think they're in such high demand. The other thing that was so attractive to me was that they actually also provide in-house postpartum care. So they really are there to support mom and baby and family in those early stages. And they do all the physical exams and check-ins in your home. And I just love the idea of that. So with an obstetrician, what often happens is that you will meet with your GP, your primary physician, for the first 20 weeks. They will overlook your care, and they will transfer to an OB at that time. And with an OB assignment, you will meet your one obstetrician, and they will be present at your birth if they are on call at the time of your labor. Otherwise, you will have another OB present who you may not have met before. For some women, that does not matter. For me, I really did care that I felt connected and knew my team before going into labor. I felt particularly vulnerable about that in the first pregnancy and labor. I really wanted to pick my team very carefully, and I was very private the first time around, which is really, if you know me at all, unlike me. But I really tried to distill down who was there and try and keep it very, very intimate. I don't know why, but that's what I did. So either way, I think there are a number of tests that I think should be considered early on. Of course, there's genetic testing you can look into, and there is blood genetic testing that can be done first before any more invasive measures are taken. And so for some couples, that's a suitable option, and you will definitely be educated in that. And I believe the blood work happens at around 10 weeks of pregnancy to start assessing for any gene issues or genetic concerns. Other tests that I think, those are optional, and based on age and health history and stress level about that, those are going to be how you make those decisions. That's how you're going to navigate that. And so you do want to work with people who will help you understand the risks, the benefits, and the alternatives to making that informed choice about genetic testing. Other tests that I think are pretty important, or ones to be aware of, are early HCG levels. You can always check doubling time if that's of interest to you, or if you have a history of miscarriage. That's obviously going to be something that's more highly indicated. If you've had a pretty uncomplicated pregnancy journey, fertility journey, that is not likely going to be something that's high up on the list of testing. But you can check progesterone levels, because for some, miscarriage risk can be due to a deficiency in progesterone. So knowing that number can be very helpful, and supplementing with bioidentical support if needed or indicated is an option. Having your thyroid tested is really important. Thyroid levels can shift significantly in pregnancy and can really be taxing on your thyroid, because the metabolic demand on the mom's body during that time is massive. And so we want to check in and make sure that her thyroid is working appropriately. For women who are on natural desiccated thyroid, if they were to conceive or actually even switched over to Synthroid, because the studies on safety and passage through the placenta to baby are all on the safe use of Synthroid. And so we will actually switch women over if they were on desiccated thyroid at the time of conception. And if a woman has thyroid concerns, we will check her thyroid levels throughout her pregnancy. Iron levels and a complete blood count to check hemoglobin levels are really important. Iron deficiency is probably the most common deficiency in pregnancy, and it can be particularly challenging to manage throughout her pregnancy, because as her body expands and her blood volume expands, hemoglobin typically goes down, and there are certain levels and criteria you need to meet to be able to have a home birth and to have a healthy birth and not be at risk of anything. So iron deficiency is something definitely to be mindful of and to be on top of and advocating for yourself. If you have the choice to do some blood work before you conceive, a vitamin D, these would all be wonderful to run, except for HCG, obviously, which is the pregnancy hormone. A vitamin D test would be great to do beforehand, because vitamin D deficiency is highly correlated to infertility and miscarriage risk. It's a great number to know beforehand. And if you were not able to test, you can test it early in pregnancy, and you can do some strategic supplementation within safe means during your pregnancy to help optimize vitamin D levels, which is why when I say any of this, you really do need to be working with someone to help support you in this journey, because this is a tightly regulated window. You can't be just supplementing with anything, and you can't just decide doses. There really is a very narrow window, and you need to be doing this safely. So the caveat to this entire episode is please do not do anything without having a really great qualified healthcare provider, a regulated healthcare provider to help support you in your pregnancy. That is so, so key. So make sure you're asking if they're regulated. Next, so you're on the list. You're waiting to interview your doctors. You're going to pick the doctor that is best suited for you. You understand that you need to ask and inquire about genetic testing and what testing values are important. You've talked to your naturopathic doctor. You've made sure all the things that you are currently taking are safe. What are some other supplements to consider when you're talking to your naturopathic doctor during pregnancy? So some things to think about and consider are a great high quality prenatal vitamin, a prenatal vitamin that contains 1 milligram of methylated folate. Gone are the days where we need to be taking folic acid or folate. And the reason for that is a good percentage of the population has the MTHFR gene. They have a genetic SNP that makes them unable to convert folic acid and folate into methylfolate. And so instead of, mass testing the population for this gene mutation, the solution is to provide activated folate so that a woman can absorb it and utilize it appropriately. Sometimes infertility risk or history of infertility or miscarriage risk can be associated with MTHFR. Same with tongue tie postpartum, and there is some behavioral aspects to consider as well. ADD, ADHD, autism spectrum can be associated with MTHFR, which is why it's so important that you take a high quality prenatal that's not dyed pink and blue and is methylated and is bioavailable vitamins. And so you're probably best off with a naturopathic doctor when discussing your prenatal vitamins, because we are educated and trained in that. And just because something comes as one a day and it doesn't make you sick does not mean it's an appropriate choice for you. So please consider that. Many of our prenatal vitamins are taken multiple times throughout the day, because there is a fallacy within like a 1-a-day product. It's not going to provide the nutrition that you think that it is. And so we have to reframe that narrative, because I think it's been damaging in the sense that if we think, Centrum Complete, the 1-a-day, we think those are fit for nutrition, then it's really hard to get our brain around how many supplements it actually takes to make a shift in our vitamin and mineral levels within our body, what we can absorb. Other ones to consider, I find in the first trimester, it is a challenge for women to, how do I want to say this? It's a challenge to take multiple supplements. And so sometimes if all we can get a woman to take is a prenatal, then I'm really happy with that for the first trimester. I also, if she's able to take more supplements, which, I think a lot of women are, I think a great quality multi-strain probiotic is wonderful, and an omega-3 fatty acid. And the omega-3 is particularly valuable because it helps with building baby's brain and nervous system. The DHA is what our brain is highly composed of. And if they're not getting it through supplementation, then they are stripping it from mom's brain, which is a lot of the reason we attribute mommy brain to that particular time, is that it can be incredibly depleting. So supplementation can help mitigate that risk and optimize, and it's anti-inflammatory and can help support actually mood postpartum. So it's wonderfully important. And I do really stress it in the second and third trimesters in terms of trying to prevent postpartum depression or anxiety. And a probiotic is great. We used to think babies were born sterile and that the microbiome didn't transfer over to baby, but we have been able to demonstrate through a number of studies that that is actually untrue. And some of the most impactful strains for helping to help baby have a modulated immune system, so one that is at lower risk of developing allergy or ectopic diseases like asthma and eczema, are ones that are multi-strain and balanced, but also contain lactobacillus rhamnosus. And so I definitely talk to moms about probiotics as well, because I think that's incredibly important for them to consider in terms of helping their baby have a more modulated, normal function immune system, which is critically important. Those are generally the supplements. Vitamin D, if it's not in any of the other supplements, is an option. Extra iron, if it's indicated. Really, we customize these to help support mom. Is she stressed? Is she not sleeping? Is she constipated? Does she have headaches? Is she nauseous? So we will always recommend other supplements depending on what's going on with mom, but that is like the basis. That's the basics that I think are essential for all women to be taking. Of course, a dosage and product lines that you have been advised to take by a qualified practitioner. So what happens when you have symptoms in that first trimester? There are a number to talk about. So first being morning sickness. So morning sickness is a very common symptom in that first trimester. It usually starts to creep up around week 6 or 7 of pregnancy. And at that time, women can struggle to get food down. They can struggle to eat at all. They have difficulty meeting their daily life qualifications and requirements because it can be particularly challenging. It's not fun. I experienced it both times. I really did not like that symptom. I didn't do a lot of vomiting, but nauseousness, I felt a lot. Morning sickness has to do with, or can be alleviated with the use of vitamin B6. And so diclectin, which is the really common medication that is used during this time, is actually a derivative of vitamin B6, which is why it works so efficiently. So working with your qualified healthcare practitioner, they can educate you on dosing of vitamin B6, which is something that you can try first. Ginger, which can be fantastic at helping ease off some nausea and vomiting symptoms. Acupuncture can be wonderful. There are certain acupuncture points that are indicated and safe in pregnancy that can help alleviate the symptoms of nauseousness and vomiting. And C-bands can also be placed on the wrist. They help to prevent motion sickness, and also as a result help to prevent nausea and vomiting in pregnancy. So some women will wear C-bands around, which just stimulate an acupuncture point that is really effective for lowering nausea and vomiting. Here at the clinic and at many clinics, we will use intravenous vitamins as a way to help support women. So we can put higher levels of vitamin B6 in that bag. We can add magnesium and zinc and selenium for thyroid support and immune support, vitamin C. What I also find is particularly helpful with the nausea and vomiting is that these bags are bigger and they provide a lot of hydration. So they rehydrate our pregnant mamas, which really helps women feel better, especially if there's cases of hyperemesis gravidum. Often that's a transfer to the hospital to get rehydrated. So same thing. We can actually help use the saline plus vitamins to help alleviate some of your symptoms, which is incredibly important. And we'll use them throughout pregnancy. You can actually do higher doses of vitamin C intravenously that are safe in pregnancy that would not be safe orally, because it would stimulate, can be stimulating for the digestive tract and stimulating in general. That effect doesn't happen when we are using it intravenously. And there are other vitamins and products that we can put into an immune support bag. So if you are getting frequently sick with colds throughout your pregnancy, an IV vitamin bag might also be a really viable solution for you to just help immune function and help support you in your pregnancy. Constipation, another really popular, common phenomenon of first trimester pregnancy, because progesterone is another pregnancy hormone. And we like that to be nice and high for a very strong pregnancy. That has progesterone makes the digestive system sluggish. And so it is an inevitable side effect. Not all women experience it, to be honest, but a lot of women do. And it has to do with nice progesterone levels. So it can be indicative of a healthy pregnancy. I'm not saying those things are correlated at all. I apologize if I just made that correlation. But that is why it's happening. And there are a number of ways we can help support women through constipation. We can talk about fiber intake, hydration. Ladies, I would love to stop talking about hydration. So if we made an agreement and you drank more water, I can stop talking about it. But water is critically important. Aim to drink 2 to 4 liters of water a day. It's just that important. It's just got to be part of what you do. Get a water app on your phone as a reminder. Put elastic bands on your water container and remove them as you hydrate yourself. Whatever triggers you need to help you be more compliant, water is essential. It's essential. Magnesium citrate can be a great way to help support bowel regularity. It can cause an osmotic effect on the bowel, and therefore can be a wonderful choice. Again, you want to learn about safe dosing in pregnancy. Vitamin C can also help facilitate that. So combined, it can be a wonderful solution for women. Let's talk about nutrition in pregnancy. Oh, hold on, headaches. I'm skipping all over the place. Okay. Headaches are a really common phenomenon as well. You may be dehydrated. You may be lacking magnesium. It could be the hormonal shifts. It could be the massive shift in your nutrition, because a lot of women can't eat high volumes or they have to eat more frequently. That can be a result. That can result in headaches. it is important that you are, if it's safe to do so, to be considering body care, seeing a chiropractor, an osteopath, a massage therapist. I think can be incredibly helpful. Acupuncture can be helpful. Making sure you're drinking water. It is really important to note that if you do need to take something for headaches, that Tylenol is actually the safer choice in pregnancy. In most cases outside of pregnancy, I don't really like to use Tylenol that often because it's more challenging on the liver and interacts with more things such as alcohol and other medications. But taking things like Advil and ibuprofen and Motrin do have risks of, you do have higher miscarriage risk. And so it's something to be informed about if you didn't know that. If you have lower back pain, there are normal pains and growth pains of early pregnancy that can be, the first time, if you've never experienced them, a bit unusual and a bit unsettling. It's normal. It's the uterus stretching and growing. If your body's never moved those tissues before, you can feel that. It can feel like a challenge for sure. Again, so getting body work done can be helpful. Acupuncture can be done as well, and more safely until the second trimester for low back pain. Nutrition. So like I said, I think women struggle in the first trimester, and I think it's an interesting time. I think most women start to crave more carbohydrates than they normally would. And so we want to help support women through their nutrition journey and understand that if they can pick lower glycemic, complex carbohydrates, that would be recommended. I do think I trust the body's innate intelligence. I do think that is a time where women need to be taking in more carbohydrates. And so to listen to that and tune into it and try and make the best choices as possible. Eating small, frequent meals can be more helpful for alleviating nausea risk. So I think that's really important. So if, pre-pregnancy, you're really rigid about, eating every 4 or 5 hours, or you engage in intermittent fasting, these are the times. Pregnancy is not the time to be in any way strategic about those things. You need to listen to your body. You need to eat more frequently. And you definitely want to tune into what your body's craving. You may also experience some aversions. And those aversions are, you just got to listen. There was one pregnancy, I'm starting to forget, that I didn't, it may have been my first pregnancy. I could not drink a single smoothie. I love smoothies. If you know me, I'm like diligent about my smoothie consumption because I just find them very convenient for my lifestyle. And I couldn't drink a single one until I literally gave birth, and then was like, where's my smoothie? So it's very, very interesting how these things come up. One pregnancy, I struggled taking in more animal protein. The other, I really did crave animal protein. I'm not a vegetarian, but I just, found that stuff very interesting. Actually, I wonder if that's correlated to my children's blood types. Anyways, I digress. You want to be striving for more fiber. So you want to track that for sure. You want to aim to get higher, like closer to 30 grams per day. The average person takes in 15. So you want to think about doubling what you might be normally taking. You can always calculate that. You want to think about foods that contain omega-3 fatty acids. So walnuts, flax seeds, greens. You want to take in natural sources of folic acid. So your leafy greens can be really helpful. You want to have protein at every meal. Balancing blood sugar levels is critically important in pregnancy. And I think we tend to easily reach for carbohydrates and tend to forget about protein. So you really want to be cognizant to be choosing more protein dense foods and lowering your carbohydrate intake. Or it's not necessarily lowering it, just making sure that you're making sensible choices with your carbohydrate intake. So if you're having animal protein, if you're doing smoothies, you can use collagen powders, or certain protein powders are safe in pregnancy. A lot of the ones that contain greens would not be recommended. A lot of those will have detox herbs in them, and those are not suitable for pregnancy. It's not a time to be detoxing of any kind or stimulating any detox pathways unnecessarily. So you do want to be going over that with your healthcare provider as well. And you want to eat, take in healthy fats, So reducing, or hopefully you're not taking in any trans fats, but eating healthy fats such as avocados, nuts and seeds, olive oil, coconut oil, all recommended in this time. And then I wrote be carbohydrate conscious in my handout. I think that's the key. You're going to crave them more. I think there's a reason for that. I think you should listen to your body, but try and pick lower glycemic index. The thing is that people don't realize is that your risk for, well, maybe you do, is that your risk for gestational diabetes is high. And okay, hold on, that's incorrect. Scratch that. There is a risk of gestational diabetes that you need to be mindful of. And even if someone has a normal body weight, healthy nutrition status outside of pregnancy, doesn't mean you're not at risk of or not going to get gestational diabetes. We interviewed someone, Dr. Sarah Olahan, on the podcast. You should go listen to her episode. It's amazing. Really healthy naturopathic doctor, gestational diabetes both times, and well controlled through a paleo diet both times. So there is amazing nutrition options, but just really be cognizant of blood sugar levels and balancing out your foods with healthy levels of protein, and being very mindful that increased or too high carbohydrate rich diet, too high sugary diet does put you at risk of developing gestational diabetes. And that does have impacts later on in life. You are at much higher risk of developing diabetes later on. And that's what I have to say about that. You want to eat the rainbow, like we always say. You want to eat fruits and vegetables that are really diverse in color. They contain all different nutrients and vitamins and minerals, and you want to have a healthy dose of all of that, especially from your food. You do want to lower your caffeine intake. Studies have shown that it's safe to have 1 coffee per day. That's 250 mils, people, not a grande or venti, right? An actual cup of coffee, or 2 caffeinated teas per day. A high caffeine intake is associated with lower birth weight of infants, and a low birth weight has been shown to put one at higher risk of chronic disease such as obesity, high blood pressure, and diabetes later on in life. I talk about limiting fish intake. You can choose fish that are of the safer variety. The acronym is SMASH, and you can go look that up for the safer food fish that are lower in mercury levels. They're usually the bottom feeder fish. The fish tend to bioaccumulate metals the bigger they are, because they eat all the little fish and accumulate those metals. I eliminated it altogether. That was a choice that I made. You certainly don't want to eat raw for risk of E. coli and listeria and other infections. And you just want to be very mindful of heavy metals. So a lot of fish contain metals. And if you've never been told that before, that's why we talk about fish consumption in pregnancy. And I very much limit it or reduce it altogether. I would max it out to 1 to 2 times per week if you're going to consume it. And I would only consume the fish from the acronym SMASH. Go look that up. No raw fish, no soft cheeses, no unpasteurized of any kind. Make sure you listen to your body and you don't resist. Weight gain. It is what would be considered normal weight gain in the first trimester is 1 pound per month. And all you need extra calories per day is 150 to 200 calories. So just to put that in perspective, exercise, you can pretty much keep exercise as it was, what you did before pregnancy. It can help ease constipation. It can help, maintain a stronger pelvic floor. It keeps you healthy. It can help with sleep. It can help with stress reduction and anxiety. So super important thing to consider in that first trimester. Like I said, I experienced a lot of those symptoms in both my pregnancies. I had a lot more morning sickness with my daughter. My second pregnancy, I had morning sickness, I think for 7 to 19 weeks of my pregnancy, which was incredibly exhausting and draining. And I found that if I had a busy mind, if I came to work, I actually didn't feel it at all. It was actually when I was at home doing nothing that I felt significant symptoms of it. I truly, well, I didn't love pregnancy, but I love treating women in pregnancy. I think it's a really exciting time. I really want to help women feel empowered in this time. I want it to be a very positive experience as much as possible. I hope that women feel glowing. It's unfortunate that I didn't, but I want to help support women to feel good and to feel healthy and feel strong and confident in their pregnancy. Another thing, last thing I'm going to say is to consider doula care. If that's not something you're familiar with, then you can go research that a little bit. But doulas provide support for the couple during labor and delivery. They help prep you by helping you with a birth plan. And we all know birth plans never come to fruition, but it is an important step, I think, for women, because there is a point in your labor where you transcend to a different place, and you really want someone to be able to advocate on your behalf when you can't speak for yourself. And a birth plan really helps your team advocate and communicate your wishes for you if they are able to do that. Meaning if it's safe to honor your wishes in your labor. Doulas are really great with pain management. They are the experts at birth as support, and they are there to help you feel empowered and safe in that whole journey. Birth can have challenging moments, and having someone there who has confidence and who has been there before and can hold space for all of your emotions and help you through them makes a big difference. I had one birth with a doula, and I had one birth without a doula. And all I can say is that I highly, highly recommend having them at your birth. They are so amazing at helping support the couple, and in particular the mom, and for the postpartum care and the mental prep beforehand and learning your wishes. I'm going to share all of my tips for labor and delivery in episode 3 for you, because I've been there and I think I've got some good tips. But that would be my first one. If you are in your first trimester and you are listening to this, or you are thinking about getting pregnant soon and you are listening to this, then do some research. And we absolutely make recommendations here at our clinic. We work with incredible teams of doulas throughout the GTA that can help support you on your journey. And birth is awesome. I love to change the narrative that this is something that we need to be afraid of, that it's something that is painful or scary, or it's all about just gaining weight and, feeling tired and all the things. It's a really magical, transformative time for a woman to start to really, become very deeply intuitive and listen to her body and trust and advocate for herself. It is the birth of a mom, and it is an incredible journey. So I am so excited I was able to share so much with you today. I am surprised with how much I have to share about the first trimester. I recommend that you see your naturopathic doctor at least once in your first trimester, and then if you have symptoms, to see them continuously throughout as they recommend to help support your symptoms. And we are here to be part of your team, and it is an amazing, wonderful thing to be a part of for women. And I love and am deeply honored when families choose to work with me, because it is my jam. I love this time in a woman's life. I think it's a critical time, and I think it's important that you make informed choices. And so that's what this episode was about. That's what this series is about. And I hope you enjoyed it. Please share with all the pregnant mamas, the mamas to be, and the women who just are birth junkies like myself and like to learn. I hope you have a wonderful day. I hope you're enjoying the sunshine. Wishing you much love, and I will talk to you next week.